Good afternoon. My name is Victoria Bracey, and this is Ainslie Curtis. We are both majoring in health sciences, and we're excited to be in the healthcare field one day. We want to pursue higher education and value ethical standards. Through this presentation, we learned about the Health Insurance Portability and Accountability Act and the applications for our future careers as healthcare professionals.
HIPAA stands for Health Insurance Portability and Accountability Act. It serves to help protect sensitive patient information. As seen in the graphic on the right side of this slide, nearly 200 million patient records have been compromised from 1996 to 2018. Additionally, approximately 1 in every 4 HIPAA breaches are still not reported. A breach is defined as the acquisition, access, use, or disclosure of protected health information in a manner not permitted, which compromises the security or privacy of the protected health information, according to D. Simone. Therefore, healthcare professionals should not review medical records if they do not have permission. According to the HIPAA Guide, although hacking incidents only make up just over half of all breaches, even in recent years, the overwhelming majority of individuals affected by breaches are linked to one of these incidents. When HIPAA guidelines are broken, large fines and other severe consequences arise. These consequences can drastically alter the nurse's life financially and also socially. When a HIPAA lawsuit occurs, it cannot simply be swept under the rug. The nurse can be fired from their job, which majorly disrupts their way of life.
Because of the guidelines listed in the Code of Ethics, nurses have a responsibility to maintain patient confidentiality. According to the do's and don'ts of social media use for nursing professionals article, HIPAA makes it a legal requirement for nurses to keep all protected health information confidential. According to DeSimone's article, when is accessing medical records a HIPAA breach? Protected health information is defined as individually identifiable health information that is transmitted by or maintained in electronic media or transmitted by or maintained in any other form or medium. The Nursing Code of Ethics addresses privacy and confidentiality in Provision 3.1, saying, confidentiality pertains to the non-disclosure of personal information that has been communicated within the nurse-patient relationship. Furthermore, Walker explains in Understanding HIPAA and Patient Confidentiality implications for nurse educators that Provision 3.1 also affirms that the nurse has a duty to maintain confidentiality of all patient information, both personal and clinical, in the work setting and off-duty in all venues. HIPAA exemplifies the confidentiality aspect of the Code of Ethics by making it a legal requirement for nurses to keep protected health information confidential.
Following the HIPAA standards is a team effort that requires collaboration from multiple parties in order to adequately uphold the HIPAA regulations. The Code of Ethics addresses the importance of collaboration in Provision 8.1. It says the complexity of healthcare requires collaborative effort that is strong support and active participation of an interprofessional team and involves the recipient of care. Collaboration optimally requires listening, mutual trust, recognition, respect, transparency, shared decision-making, accountability, and open communication among all who share concern and responsibility for health outcomes. It extends to everyday relational ethics when intraprofessional, interpersonal, and nurse-patient collaboration is necessary. Being able to trust the healthcare provider gives the patient confidence to freely express what they are experiencing and any concerns they might have without fear of it being spread to people that are not involved in caring for the patient. This allows the patient to receive better care overall, since being honest with your healthcare provider gives the provider a better understanding of the situation. This leads to better treatment overall. Essentially, one singular party is not solely responsible for ensuring the regulations are followed. It would be unfair. Prioritizing the HIPAA guidelines is everyone's responsibility, from the nurses to the doctors to the CEO of the hospital.
HIPAA was passed in 1996 by the Clinton administration. Before HIPAA was established, there was not a set-in-stone federal law on storage and sharing of sensitive patient information. Different states had different laws, but on a national level, the standards were lacking clarity. HIPAA established a clear nationwide guideline on how medical information should be accessed and stored. According to Moore and Fry, HIPAA wasn't fully implemented until 2003. The HITECH Act was added in 2009. This addressed the implementation of electronic records. With this addition, more severe financial penalties were instituted.
The Do's and Don'ts of Social Media Use for Nursing Professionals article discusses how being mindful when navigating social media is key as a healthcare worker. This article includes several benefits of social media use, such as sharing information, advocating for training, and networking. However, the article highlights the potential adverse effects when social media is misused in the healthcare field. Sharing protected health information is a violation of HIPAA, which can result in the healthcare worker losing their license, their job, or even both. The article advises healthcare workers to be cautious of what they share online and how they handle patients' private information. The article, Ensuring Compliance with the HIPAA Security Rule, Think Twice When Emailing Protected Health Information, focuses on the preventative measures to take when communicating protected health information over email. The article reinforces the idea of ensuring that the email belongs to the correct patient and is kept private. The email should not be accessible to staff that are not responsible for caring for the patient. Before any personal information is shared, the patient must give written consent for their information to be discussed electronically over email.
The article, When is Accessing Medical Records a HIPAA Breach, addresses the requirement for only authorized personnel to have access to medical files. Access to the files is monitored by an audit log, according to DeSimone. The audit log helps to maintain the security of medical documents and ensures that only authorized individuals have access to the electronic protected health information, as seen in the infographic on the left side of the screen titled HIPAA Audits. Incident management is crucial. In the case of a HIPAA breach, hospitals should have a process in place that quickly and efficiently addresses the situation. For example, the article highlights employees at a hospital viewing medical records out of curiosity, even though they did not have permission to see a patient's medical information. This resulted in them getting fired. The patient who sought out treatment did not deserve to become a case that entertained the nurses. Patients should feel safe to receive care without fear of judgment. Nurses should have their patients' well-being in mind and should not do anything to compromise their privacy.
According to the intersection between medicine and law, legal nurse consultants' roles and responsibilities under HIPAA article, even nurses who are serving as legal nurse consultants are required to still adhere to HIPAA guidelines. According to the article, legal nurse consultants straddle the line between the legal and healthcare industry, and therefore also straddle the law, according to Friedman and Radigan. Although this position can lead to difficulties in distinguishing what is appropriate to share, the bottom line is that legal nurse consultants are usually subject to HIPAA and state laws applicable to the access, use, and disclosure of health information, as well as contractual provisions set forth in business associate agreements. This reinforces the severity and importance of following HIPAA guidelines. Legal nurse consultants must remain aware of the law and guidelines even when they are not directly providing patient care. Thus, the legal nurse consultant must be aware of the HIPAA laws and abide by them as a professional.
According to Understanding HIPAA and Patient Confidentiality, implication for nurse educators, violating HIPAA policy results in consequences. This could include lawsuits and fines. If you are a nursing student, violating HIPAA could result in expulsion from the nursing program. Nursing students are expected to understand and adhere to confidentiality policies. Being a student is not an excuse for not being educated about these policies. According to Walker, nursing educators have a responsibility to make nursing students aware of legal and ethical standards early in the program.
Walker also said programs should consider discussing patient confidentiality in new student orientation and onboarding, with continued and frequent reinforcement throughout the program. Many programs discuss confidentiality requirements during onboarding, and the students sign a blanket confidentiality statement that is housed in their program file. This does not eliminate the need for students to sign additional confidentiality statements if required by clinical partners. Finally, it is critical that faculty and students comply with program policies as well as clinical faculty policies. Failure to consistently apply course and program policies is a primary source of student dissatisfaction and potential litigation. Therefore, understanding HIPAA and patient confidentiality has implication for nurse educators.
HIPAA is being addressed by comprehensive training in both the workplace and in nursing programs. When employees join a healthcare team, they are provided with extra training to ensure they are knowledgeable and up to date on current policies. Additionally, most hospitals do not allow taking photos or videos while at work. This helps prevent any data breaches.
Nursing students are held to a higher standard than your typical college student. Nursing students are responsible for human lives and supporting their patients' overall well-being. For this reason, nursing students are required to have a deep foundational understanding of HIPAA policies and procedures. As a healthcare professional, they are held responsible for their behavior and acting according to the ethical guidelines. Lives are not only at stake, but the quality of life, which comes with privacy, cannot be compromised.
As seen on this slide, there are different levels of HIPAA violations and varying fines based on the offense. According to DeSimone, individuals who knowingly obtain or disclose individually identifiable health information in violation of the Administration Simplification Regulations face a fine of up to $50,000 and or imprisonment up to 1 year. The penalty can be increased to a $100,000 fine and or up to 5 years in prison for violations committed under false pretenses. Finally, offenses committed with intent to sell, transfer, or use individually identifiable health information for commercial advantage, personal gain, or malicious harm permit fines of up to $250,000 and or imprisonment for up to 10 years. Therefore, medical professionals should be held accountable for their actions.
Some ways to ensure HIPAA is being followed include staying informed and up to date on changes. Provision 5.4 of the Nursing Code of Ethics addresses professional competence in nursing. Nurses must maintain professional competence and strive for excellence in their nursing practice. Whatever the role or setting, professional growth requires a commitment to career-long and lifelong learning. Managers and administration are responsible for collaborating and giving staff the proper training. Holding meetings frequently ensures that all questions surrounding HIPAA are adequately answered to prevent any misunderstandings amongst staff. Other examples of how to stay HIPAA compliant can be seen on the infographic on the right, such as creating detailed policies regarding HIPAA.
Other practical ways to ensure HIPAA is followed include making sure only authorized staff are allowed to view procedures as well as medical files. Medical professionals are held to a higher standard when it comes to their online presence. They're required to maintain a professional environment. Staff are trusted with their patients and should prioritize their patients' right to privacy. The patient-nurse relationship should not be negatively affected by breaches in confidentiality.
In conclusion, the main goal of HIPAA is to protect patients' privacy and medical information. The consequences for not doing so can be detrimental to the professional's reputation and the patient's privacy. Having a comprehensive understanding of HIPAA is crucial as a healthcare provider. If you see or hear a healthcare worker violating HIPAA, you as a fellow provider have a responsibility not only to your own personal morals, but to your patients as well. You have a duty to speak up and advocate for the patient.
Provision 4.1 of the Code of Nursing Ethics elaborates on this reading. Nurses are responsible for delivering competent, compassionate, person-centered care within their scope of practice. Nurses are accountable for fulfilling their ethical responsibilities. This includes choices to take or not take action. Nurses are always accountable for their judgments, decisions, and actions. The choice is yours. What kind of provider will you be? Will you be the provider who advocates for your patients or the one they need advocating against?
During this presentation, we learned so much about HIPAA and will be able to apply it in our future careers as healthcare professionals. Thank you so much for listening to our presentation. These are our references that we use. Thank you again.